Tom Howson House is the one and only and the first ever UK-based addiction treatment centre, which is specifically for military veterans. There's a number of these type of centres in the US, but there's never previously been one in the UK. And we treat veterans who have got addiction issues, and we only treat their addiction issues, but they may well come in with other co-occurring disorders. We don't treat those other co-occurring disorders, but we're trauma-informed and mental health informed enough to be able to either refer on or to call in other services to work jointly with us should those symptoms of those other co-occurring disorders have a flare-up whilst they're having their addiction treatment here. At Tom Howson House, we see the phrase co-occurring disorders used a lot because military veterans will often come into us not just experiencing addiction, but experiencing lots of other things. So quite severe depression, quite severe anxiety, post-traumatic stress disorder, and some instances bipolar, and in some cases some psychotic episodes as well. One of the reasons that Tom Howson House exists is to be able to have a seamless admission into addiction treatment. Because what has previously happened when military veterans have tried to get support for their mental health conditions, such as post-traumatic stress disorder, they'll go to a particular organisation or a mental health service to have that worked with, or to be treated or theraped in some way. And what will happen is when they arrive at that service, they'll be informed that yes, they may well be suitable for that particular service, but they've got a live addiction issue. So whilst they're in active addiction or active alcoholism, their mental health can't be treated. So they then get diverted, signposted onto a mainstream addiction treatment centre. And when they get to the mainstream addiction treatment centre, the treatment centre will say, well, actually, you would be suitable for addiction treatment here, but we can't see you because you've got a live mental health condition. So whilst you're experiencing PTSD and you're waiting for the treatment for that to start, we can't actually help you with your addiction issue. So what happens is the individual is just being pushed from pillar to post, which can then exacerbate their symptoms. So they'll either drink more or they'll suffer a flare-up of their PTSD, or in some cases a psychotic episode. Particularly guys who have got very unstable kind of living conditions. So many of them living very transient from city to city, some living on the street, and some just kind of sofa surfing in people's houses. So that whole kind of vicious cycle really can kind of really upset their mental health, which then creates an even worse situation for them where they need an acute admission into a mental health unit. What we want to do is prevent that acute admission happening if we can, is to say, yes, come in and have your addiction treated with us. We won't work with all your mental health issues. We'll be aware of them and fully informed of them. However, if they start to flare up whilst we're working with your addiction, we would easily be able to refer on to a named individual for them to come on site and work with us, so that the individual doesn't need to be discharged. You know, if they get discharged from their addiction treatment, they're likely to use or drink quite quickly. And we also don't know if we had to discharge someone, would they be admitted into a mental health service quite quickly? Is there a service that can be that emergency responsive to them, really? So we're able to maintain people here. So while the mental health can be poor, they can still have their addiction treatment, and another service can come in and support them around their mental health. So we try not to exacerbate any symptoms. Our programme is designed to be low-level intensity. So it's high intensity in terms of the amount of time people are here with us. So the programme is highly structured, and people are kind of working with us 9 in the morning till 9:30, 10 o'clock at night. So it's quite detailed and structured in that way, and high intensity in that way, but it's not high intensity in the way that other rehabs are. So a lot of mainstream rehabs are high intensity because they're doing psychotherapy on a one-to-one every day, and they're also doing group psychotherapy, interpersonal group therapy each day. And for somebody with other co-occurring disorders, particularly PTSD, that can be quite triggering in itself. So lots of flashbacks can occur whilst being in an interpersonal group therapy setting with other people. And particularly because other people in mainstream addiction treatment centres may not have that level of awareness for veteran issues and also for mental health issues. They may be absolutely spot on in terms of addiction issues, but won't know how to really work with the other kind of surrounding areas. A question that we get asked a lot at Tom Harrison House is kind of on two levels. What's come first? Is it somebody's addiction or somebody's mental health issue? And the second one that we get is what's come first, their addiction or their military experience, or did their military experience cause their addiction? And in a way, there's absolutely no answers to that. And in many situations, we wouldn't want answers to that really, because it starts to look at the blame game. Well, this is to blame, this is the cause. What we really want to do is find a pathway that enables it to be treated in the best way possible, and to provide bespoke responsiveness to individuals, as opposed to this is the system, that's the system that you have to fit into. We focus more on this is our model. What we're hoping is that you will fit into this model, and if you can't, we will tweak this model to try and work with you more so. And I think many people come in kind of identifying that actually they've kind of had poor mental health for a long time, and what they've done is they've just poured substances on that and tried to self-medicate. So on some levels, when they stop drinking, their mental health actually gets worse. And so we have to be very aware of how we might manage that. Should they come in, if they get other symptoms and other distressing type conditions, we want to make sure that we're able to be immediately responsive to that. In the same way as when people come in and say, well, actually, I think my drinking has contributed to poor mental health. Again, we don't know. It may well have been, people will talk about they come in and after a long period of using skunk, that they have really poor mental health problems, and particularly in terms of psychosis, and they believe that the skunk caused that. And I actually am not a medic, and I don't know. And what I really want to do is focus much more on not what was the cause, but actually how do we alleviate people's symptoms? How do we support them to live much more creative and powerful lives? And how can we do that in a way that they feel they have a level of ownership in that they're just not being medicalised or theraped or treated all the time, that actually they form part of a community, they're part of a collective group where they feel like they belong, they can care for other people, and that they feel like they're purposeful. Again, people will ask us, do you think the military caused their addiction or their alcoholism? And again, I have no idea. Often many young men will go in, particularly to the army, having tried to escape a poor early life. So they may well have had very low self-esteem, poor family lives, poor attachment, difficult relationships with partners, difficult relationships at school, lots of elements of bullying, where people try to escape that life and to go into the family that they never had. So they immediately feel, when they get into the armed forces, that they belong, that this is going to be exciting. Finally, they kind of find something that they really wanted. But then the distressing circumstances around the situations that they find them in, either combat or other particular situations in the armed forces, encourages them to drink, to kind of wipe out those feelings. And also, because the culture in the armed forces is very definitely kind of work hard and play hard, that drinking becomes such a culture that actually a lot of men, when they arrive here, don't even realise that they've had a problem. It's a whole load of other people telling them that they've got a problem, and we need to educate them around what addiction and alcoholism really is. So there's recently been two quite new pieces of research, and looking mainly at what are the kind of two main issues that are affecting military veterans. And the two main issues are alcohol and PTSD. So the numbers in terms of alcohol abuse are quite massive, really, compared to the national population. So there's statistical information now that says that anybody in a mainstream population experiencing an addiction or alcoholism problem would be, in terms of figures, around 6%. Whereas more recent research is saying the figure for anybody who's a military veteran to be an alcoholic or an addict or experiencing any kind of substance misuse issue is around 13 to 16%. So you can see that jumps up more than half. It's mad. It's double straight away. So for us, there's a direct correlation, which means for us, somebody has to be responsive around this issue. We can't just all keep skirting around the issue saying, oh, well, you know, veterans can just go into mainstream treatment centres and get help. It's clearly that there's a double whammy for them, that they feel that they've kind of left service, they've been either medicalised out or discharged, might be dishonourable discharge, and they've come out feeling less than, not feeling part of again. So that's an issue for them. And then they feel like they've got nobody to turn to because civilians don't understand them. And from my experience, what I saw in mainstream treatment centres was that military veterans would not want to trust the community that they were in. They'd be hyper vigilant around who was in there, where was their information going, who might use it against them. And in fact, they were also quite frightened about sharing and getting vulnerable because, again, military veterans have been trained to be killers, right? They've been trained, they say to me, we've been dehumanised, but when we left, nobody rehumanised us. So for us, it's really, really important to develop this programme in a much bigger way that allows people to come in, feel part of, feel like they belong because it's other military veterans in the group with us. But for us not to then create dependency on us and to create separation and to only replicate the problem that they came in with, because at some point they have to leave us. So our job is to firstly, obviously, work with the addiction and potentially support them around their mental health. And then our second job is to move them directly into mainstream society where they feel purposeful. So they begin to feel like they belong in civilian life. And we can do that because the nature of the programme that we run here isn't full of therapy all day long. It's much more community based. It's looking at people's assets, looking how we can plug them into other roles, looking at where they will feel purposeful and what function that they may have that they think that they could adapt. So it might be some kind of military function, it might be something that they've got from their recovery, but that they take that into mainstream community life. And so I think what we're doing is a great bridge to normal living. And I think our opponents who say, you know, don't create military veteran specific addiction treatment because you're only replicating and re-impacting them with the trauma of when they left. Actually, there is no case to answer there. We're actually doing the opposite. We're reintegrating them in a way that mainstream treatment centres couldn't do, because we're giving them a platform where they instantly belong, and then we're giving them that platform as a bridge into normal living, and it works really, really well. And I think there's a lot we could potentially now begin to teach kind of veterans on a national level, particularly veterans organisations, where we could begin to work with them, work with the MOD, work with commissioners in the NHS to show them actually this model works and there's some really good information from it so far, and to involve people in developing something that would create a pathway on hopefully a hub and spoke model that would allow people in whatever area they live in, not just if they live up here in the northwest, to come to Tom Harrison House. And that's currently what we're doing, is looking at developing something that is completely brand new, where we begin to join forces with other organisations and run a Tom Harrison House as a specialist unit for the UK, really.